I'm Dr. Claudia Kim. Today I'm going to be talking to you guys about a breast lift or a mastopexy. So who needs a breast lift? So with just time alone, women will start to experience sagging of the breast by just, as time goes on, or if they've been some kind of pregnancy or significant weight loss or weight fluctuations, you will start to see changes to your breast and the position of the breast. So who is a candidate for a breast lift? So I always like to do this little exercise where you take a pen, okay? You're gonna put it underneath the breast and see where the nipple sits in relation to where the pen is. So if your nipple is below where the pen is sitting, most likely you are going to need a lift or to bring the position of the breast to become a little bit higher and a little bit tighter. Just for clarification, a breast lift is just changing the position of the breast. Now obviously there's other things that you can do in conjunction with it. So previously I've talked about doing fat grafting to the breast to add a little bit more volume, or using implants, either silicone or saline, to augment and make the breast more fuller. So again, for a breast lift, you don't add volume. Sometimes in the beginning, because of swelling, it can look larger, but obviously when the swelling subsides, they become more of a natural position and a natural shape to the breast, but it doesn't add volume. Now, if you are deciding to address your breast after pregnancy, a common question that I get asked is, when can I do the surgery? So it is recommended to wait at least 6 months after pregnancy to have any kind of surgery to your breast, just because there are changes to the size, obviously with lactation and the glands. So you really want your body to heal and calm down from the stresses of pregnancy before we intervene to the chest. Now, if you are obviously above a certain age where you do need to do breast cancer screening, so currently the guidelines are to start your breast cancer screening at the age of 40, unless you have some kind of positive medical history or family history of breast cancer, then the recommendations become to start at a younger age. So obviously make sure that you are taking care of your body first and doing the proper surveillance before you do any kind of elective cosmetic surgery. Now, another question that I get commonly asked is, am I going to lose sensation in my breasts, or specifically the nipples? Now, you potentially can lose some sensation to the nipple or the breast, especially if you've had a breast lift or any kind of breast surgery done before, because you are disrupting the nerves which provide the sensation to the nipples or the breast. Obviously, it differs with each person, but it's always a possibility, and you do need to understand that you can have changes in sensation. Another question that I get commonly asked is, what kind of incisions will I have? So that really depends on how much sagging there is to the breast. So if there is just a little bit of sagging, so let's say we do the little pen exercise and the nipple is sitting right where the pen is, then you don't need to have too much of a lift, thus less of an incision or a smaller incision. And that can range from just an incision at the top of the breast, almost like an upside down smiley face, or the incision could be around the nipple alone. Now, if you have other significant sagging, then the incisions obviously do get a little bit bigger, and that will be the one where we call a wise pattern or an anchor pattern, where it has the vertical component, so the straight line down from the nipple, and then an incision going across the breast on the underside of the breast, which is the anchor pattern. So you really do need to speak to your surgeon about what incision is going to be the most appropriate for you. So make sure you have that discussion. What to expect after a breast lift surgery. So considering the discomfort after a mastopexy or breast lift is actually quite manageable. A lot of patients report that they're doing just fine with just taking some over-the-counter medications such as Tylenol or Advil. And then if you are a little bit more sensitive, most people can take something a little bit stronger for about a day or two. Depending on the surgeon, some surgeons may choose to leave drains. Okay, now surgical drains are temporary devices that are a long tube with fluid collection into like a little collection bulb or like a little grenade. That really depends on the surgeon. Personally, I choose not to leave drains with breast lifts. It is a potential need for drains if I'm doing a very large breast reduction, but generally with lifts, I don't leave drains. But again, it's surgeon dependent. Now, how many days do you need to take off? So depending on what your job requires, obviously obviously, if you have a job that requires a lot more physical exertion, hands-on, you might have to take off a little bit more time. But on average, if you're sitting mostly at a desk and if you're mostly in a sedentary position, you can take about 4 to 5 days off from work. Now, for exercise limitations, I do recommend refraining from any kind of exercise such as cardio or weightlifting for about 3 weeks, and then after that you can kindly get back into your normal routine. Now, other restrictions, obviously you have to keep the area nice and clean. Okay, I recommend not going swimming or going to the beach at least about 3 weeks after the surgery. And other considerations are what kind of garment you have to wear. So I do recommend wearing a nice supportive bra. Do avoid underwire bras because that can cause a little bit of extra pressure to where the incisions are. So if you can find a surgical bra or a sports bra that's medium to light support, then that's adequate to wear for at least 3 months after surgery. I hope you enjoyed this video. Stay tuned for more educational videos like this. Bye.